Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is our crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have a problem like thinning of hair, bald patchy hair. However, with increasing pollution, the increase of stress in our daily work life, we are now seeing hair problems even at a younger age. It is not uncommon now to see 25 to 35 years old people exhibiting hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Most of this issue relate to our faulty lifestyle. Today, we have with us Dr. Deepti Rana, is a well-known doctor who specializes in dermatology. She has been practicing medicine for over 16 years now. She currently practices as consultant dermatology at Max Hospital, Noida and Delhi. Also, she is a director and founder of M.D Clinic in Noida. She has a wide variety of expertise in dermatosurgery, hair loss management, aesthetic dermatosurgery, non-surgical hair growth treatment, and clinical dermatology. Dr. Deepti Rana is aware of the need for the patient awareness and education about hair care and hence spend a lot of time in giving talks at various platforms across the country. Thank you, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show. Doctor, हमारे साथ बहुत शुक्रिया.
Thank you for having me. Yes.
So, Doctor, today we are going to discuss the hair care in current scenario. So when we talk about hair care in current scenario, the first question which pop-ups into our mind is like hair loss, and which is now faced by every, like all of us, of like no matter of any gender of or any age. So what's normal and when to be concerned for?
Okay, so recently we've been seeing a lot of concerns regarding hair fall, hair loss, hair thinning. See, all of us are really interested in looking good. That builds us and boosts our confidence. So yes, hair does play a major part in someone's confidence. So if somebody really is trying to losing hair, yes, the confidence is taken back. A lot of people are now going out to work and jobs and a lot of social gatherings. So yes, everybody does want to look nice, presentable. Hair plays a major role in how you are in front of anybody. So yes, I've seen a lot of hair fall patients and very varied kinds of hair falls and reasons, and the age group is unimaginable. What we had been studying and what we had seen for about 12, 14 years back is much different as compared to now. So even a 5-year-old or a 7-year-old is losing hair. So, and then younger generation, say about 18 to 25 is actually losing a drastic amount of hair. And then is all adults, that's gender, because of with age or genetic issues or other environmental changes people losing hair. So hair loss or hair thinning or hair fall has become a major problem these days. So majority of patients coming to a dermatology clinic, yes, are of hair fall. So hair fall could be a varied thing of just normal hair fall, strands falling. Suddenly patient has never noticed even one hair falling, but just suddenly notice say about 20, 30 strands of hair falling, or some people see hundreds of hair falling. So yet when it is above 50 to 70 to 100 hair falling a day, it is an alarming thing. That is the time when we must consult a dermatologist. 1 or 2 hair falling is fine. Maybe could be a change of shampoo, change of place, change of diet. And if it is reversible, see in about 10, 12 days, if everything comes back, absolutely fine. Do not worry. Go ahead with your regular routine. But yes, if anything which is noticeable, more than 70 hair to 100 hair per day with each combing or wash, that means you need care, you need treatment. There is something going on which needs to be addressed.
So it's an alarm when you see more than 100 hair fall, you should consult.
Like a bunch of handful of hair, then it's, yes, definitely alarming.
Okay. So, when we are talking about hair loss, so the another question comes up to the mind is like, what are the causes, or what are the general causes of hair loss?
So most important and most common causes of hair loss are post-pregnancy, post-delivery, and while feeding children with women very common. Second ones are because of nutritional deficiencies, because of the environmental changes. Also very common seasonal hair fall. So anybody noticing hair fall, season change ho gaya isliye hair fall ho raha. That is a common myth everywhere. But that season has to end somewhere. So yes, we do see monsoon is a time where we tend to lose a lot of hair. So we need to be careful there. That is one thing. The other thing is also some multi-nutrient deficiencies, like somebody also, or some ailments like thyroid, iron deficiencies, B12 deficiency, vitamin D deficiencies, or some malnourished children or people. Also very common with, if there is a genetic history of hair thinning, hair loss in the family, yes, you are prone to have more hair fall. And if you have been really injudiciously using a lot of heating agents, hairstyling products, and blow drying your hair, coloring your hair, irrespective of the need, and that goes on every week. Yes, their hair will start crying. So that's the hair's the way of telling you, enough, I've had enough damage, please stop. So that's another reason why you have these sudden hair losses and hair falls. People like to try all kinds of things that are up on social media, newer creams, newer hair packs, everything, irrespective of knowing whether it's going to suit you or not. Or what is your hairstyle? What is your hair texture type? How is your family hair texture and everything? So all those things play a role.
Okay. So the causes we know, so that nowadays we all have a poor lifestyle, late working hours, eating late, waking up late, working late hours. So does even the lifestyle play a role in hair health?
Yes, definitely. Lifestyle plays a major role in most of the present issues that we are dealing with in any form of medicine, anything. It could be just maybe working late or sleeping erratic patterns. So obviously you're not eating enough nutrition. You're not following a regular circadian rhythm that you're supposed to sleep by this time, wake up at this time. That is all changed now. Type of food that people are consuming today, so much adulteration of food and everything. Even multivitamins, people just take, okay, when they feel, yes, our counts are low, or friends are taking, then they take these newer things that have really been coming up, is those hair gummies and all. But yes, we need to know why you're losing hair. Why are you feeling weak? Why is there tiredness? Why is there some change in the pattern of your lifestyle? Because all these things will take a toll on your health and will lead to then protein loss, nutritional loss, will definitely give you hair loss.
So instead of blindly taking any supplement, it's better to find out the problem and get the solution from with the help of the doctor. So, doctor, hair loss, lifestyle. So, yes, hair loss, it is there. So, we also wanted to know what are the treatment options available for hair loss, like it is topical, surgical, or non-surgical, or can oral be also there? Just eat and get the problem solved.
Yes, definitely. So everything has to be addressed stepwise. We can't just say, okay, bal chala gaya, do a transplant. No, it may not work for somebody. So yes, we need to rule out the age of the patient, the family history of the patient, lifestyle of the patient. Then also assess their blood workup should be done, like how much hemoglobin, B12, D3, iron. So multi-nutrient or micronutrient check we should know. Their thyroid levels, vitamin D levels, iron levels, and all these. That will give us a clue of whether the hair fall is because of nutritional deficiency. If that is the reason, we cover that nutritional deficiency, we can get the hair back, along with giving some hair supplements orally. And that's the first step. Second step, irrespective of every blood count, blood workup being normal, still the patient is losing hair, then it could be a genetic problem. So family history of thinning hair, father has balding, or somebody in the family, or parent, maternal side, paternal side, anyone have a genetic history of losing hair, hair thinning, balding, or generally the whole family, everybody has thin hair. So yes, we can't really do much about it, but yes, we can improve the texture of the hair strength can be better, nutritionally the patient can be informed better. Then Also, we see a lot of these hormonal changes leading to a lot of hair thinning, hair fall. And in women, that women and men hair fall could be a different reason. But a lot of hormonal changes that we see in women, like PCOD or like SAHA syndrome, and some like thyroid patients also have a lot of male pattern hair thinning. That is, that frontal hair is thinning like how men do. Bilateral temporal receding hairline, frontal receding hairline, and very thin hair, and like losing like bunches and bunches of hair. So that's where we need to really come up and give some applications like minoxidils or some non-minoxidil lotions like Procapil, Anagain, and all these newer generation medications that we have. Then still the patient does not get better, or we are aiming at a percentage of hair growth, but the patient does not show any changes. Then we go to the third step, that is injectables like mesotherapy, PRPs, like platelet-rich plasma. Still, patient does not show a lot of good change. Then we counsel them for hair transplants, mostly done in men, because once the hair lost and receded the hairline, so then it's difficult to get an unnatural hairline without transplanting the hair. But in women, yes, we can do a lot of PRP, mesotherapy work beautifully for women. Men, yes, but not to an extent when they've actually lost a lot of hair.
Okay, so men and women equally get the hair loss problem, but it's the reasons are different, and we should consult the doctor for the right kind of a treatment. So, doctor, nowadays another word is coming into focus is nutraceuticals. So, what is nutraceuticals, and what is the role of nutraceuticals in hair health?
So see, ideally we've seen patients losing hair. We knew, okay, hair is falling, we have to give them biotin. That's it. But nowadays, it's a multi-nutrient approach that we have to go on for. We can't just give biotin and see ki haan sab theek ho jayega. No, it doesn't work like that. We do need to add on a little folic acid, a little iron supplementation, a little vitamin D, because most patients are deficient with other nutrients. So nutraceuticals have a combination of these medicines that have biotin and other multi-nutrient supplements that will actually overall take care of that overall well-being of the patient. Rather than taking multiple medications, it could be just one tablet or two tablets that would do the job for most of those cover-up of the nutritional deficiencies.
So it does like help in hair health, like hair growth, or
yes. So it will take care of the deficiency, but it's not that if you take that you will get hair. No, it doesn't work like that. We have to know the reason why we're having hair fall. We treat accordingly. What stage of hair thinning, hair fall, hair loss you are. That way we need to treat.
Okay, so like you said, vitamins, minerals. So what are the vitamins which are used in management of alopecia, like hair loss and hair loss?
Hair loss, the most common biotin that we give is biotin. Okay. Biotin works on the hair, nail strength, and everything. Along with that, we need to give a little folic acid, B12, D3, all those nutritional supplements that which actually strengthen enough protein in the diet, and also protein supplements if needed. That would help in the hair health.
Okay. Okay. And even for alopecia?
So alopecia means loss of hair. The reason for alopecia could be alopecia areata, androgenetic alopecia, underhair alopecia. There could be scarring alopecia, non-scarring alopecia. So there are plenty of reasons why we would have alopecia. Most common is telogen effluvium, that you lose hair post some illness or some infection or post pregnancy. And androgenetic alopecia is male pattern form of hair thinning that is mostly hormonal. Okay. Those are the most common forms of hair losses that we see.
Okay, so this is like vitamins. And what about the minerals? Minerals like iron, zinc, copper, do they promote hair growth?
So see, that's what I said. When we see there is a nutritional deficiency, we need to go, because also with food these days, the amount of nutrition that is being consumed is actually, it's more stress, less food, right? Or it could be mainly junk and not enough nutrients. So yes, then these nutraceuticals or these multivitamins that play a role, which would help in that deficiency that is caused. That could be a reason to give weakness, tiredness, giving rise to hair fall. Okay. But yes, if I give a nutritional supplement and your hair comes back, no, it doesn't work like that.
Okay, so it's a myth that if you just take vitamin and mineral and your hair will come
Yes.
back.
So you have 100 hair falling, you take tablet for 30 days, no hair will fall. Doesn't mean. We need to know why the hair is falling.
You need to know. So, okay. Doctor, is it required to take the nutrients as per gender RD requirement?
So yes, see there, ideally we should be taking as per the required dosages, but sometimes depending on each patient having different needs, each patient's nutritional needs are different, each patient's lifestyles are different. So all for accordingly, we need to be monitoring and giving those medications. Yes, we need to be watchful of the dosage of biotin and everything for men, women. Recently, there have been studies that the dosage here has to be different and with women has to be different. So that, yes, we need to monitor, but there's a specific daily allowance of biotin and the other nutrients that we can give to both individuals.
Okay, yes, and nowadays, like in Instagram, we have a lot of these supplement which we prescribe ourselves to, like self-prescription. So, is it okay to do it, or like we should not do this, and we should first find out the problem and then take these supplements?
Yes. See if you're taking a biotin of 8 so and so thing, you're taking a nutraceutical biotin, somebody's taking some other form of biotin. What worked for me may not work for you. What worked for the other person may not work for you. So Instagram is people's experience out there, right? But that doesn't mean that goes for you. So if they have done something in the right way, yes, please accept it, but follow the regular routine and follow that route which is actually legitimate. That means if you have hair fall which is alarming, take steps to fix it. Not just that isne ye bola Instagram pe, or this influencer told me this, or this one said this, some actress said this. We listen to everybody, but we need to follow a protocol. Like we need to see a doctor when we see a lot of hair fall. We need to know why we are having hair fall. Then we need to form a plan how we can correct it. We can't just blindly follow what is being followed as a trend. No, there is no trend for one person that fits for all, fits all.
Okay, so like blindly following anything, we should follow the protocol.
Definitely, definitely.
So, doctor, stress is something which is, it's unavoidable. So, what is the impact of stress in hair health?
So again, stress, then nutritional deficiency, tiredness, weakness. Again, this is all interrelated to stress leading to hormonal fluctuations, leading to the other nutritional deficiencies, and again, protein loss and all these things giving rise to hair fall. Most common reason, so whenever you have any form of stress, it could be a mental stress or a physical stress, that too much stress at work, so obviously you're missing on meals and all those things, there will be deficiencies. Other mental stress could be you're stressed mentally, and then things are being affected. So yes, everything is interconnected. So your hormonal fluctuations will start. That will lead to another hair loss, hair thinning, hair fall, and further other things like weight gain and mood swings and irregular periods. So all these will play a role in leading to hair fall.
Okay. Okay, so the doctor, when we talk about stress, like at home, like when we are stressed, our mother advises just to get a massage of oiling and oil your hair. It is good for your hair also, and it will make you stress free also. So oiling is a ban or a boon?
So see, mothers telling you to get a oil massage, I wish everybody could do that, and then there would be no stress in the world. If it was so easy, then that word stress wouldn't have been stressed upon so much. But yes, oiling does block the hair follicles and gives rise to other issues like folliculitis and makes the hair back. But yes, we've been hearing oil your hair since childhood. It increases blood circulation and everything. But see, oiling actually is really not doing much. So if you really have enough time or you really feel like doing once a while oiling for 5 minutes, a little bit head massage, no problem, then wash your hair. But these overnight oiling and regular oiling and every 2 days oiling will just lead to oil gland overactivity, making you more dandruff, give you hair, like sometimes makes the hair frizzy. Sometimes the people complain of hair fall post hair oiling and all that. So If it works for you, fine. But I would say hair oiling will really not change much. But I'm not saying don't do it. Yes, you can do it once in a while with a light hand. Don't do a frictional head massage, which will give you more hair fall, which will give friction and you'll pull out more hair. So all that shouldn't be done. Once a while, head massage, lightly, okay. Don't go in for a head massage like a full chumpy. That can be avoided.
Okay. So once in a while is okay, but not a regular habit should not be followed.
Right.
Doctor, what important tips you would like to give us for healthy hair?
Okay, most important, nutritional. Follow a good diet, that is, follow a regular routine. You must have enough protein, enough carbohydrates, no crash dieting. A lot of people with crash dieting notice like so much hair, especially these fad diets like keto and all makes you lose so much hair, and then it's difficult. Patients then has lost weight but come crying with hair loss. So yes, follow a good diet, have enough proteins in your diet, have enough fruits and supplements and everything. Also, have a regular routine like a sleep pattern and everything. Avoid oiling as much as possible. Do not do a lot of heat to your hair, that is hair dryers, blowers, steam, sauna, and use a white tooth comb to comb your hair. Do not comb your hair when they are wet because they're a little more brittle. So you pull the hair out. Do not do a frictional head massage. Do not tie your hair very tight with those slips because then you'll have a tractional alopecia that your pull will give you loss of that patch and you will lose hair from there. So all these things will help if you avoid and do it in moderation. You will take care of your hair.
Okay, quite interesting tips, ma'am. So this discussion was very informative, and I'm sure our viewers would be benefited by it. So, doctor, can we take some questions from live audience?
Yes, please.
So, our first viewer is asking, can graying of hair cause hair problem?
Graying of hair is a problem. What that will not cause hair fall. So graying of hair also depends on also genetics. Sometimes people start graying early. Sometimes people start graying very, very early, like about 7 years of age, 10 years of age. All this is related to aero-environmental factors, nutritional factors, genetic factors. So yes, graying per se will not give you hair fall or hair thinning.
Okay, and sometimes the graying hair is also seen in young age.
That's what I just said. Yes, very young, we are seeing graying of hair. Very common. Yes, yes, yes.
Okay, so another viewer is saying, please ask my question. What should be the ideal water intake for healthy hair?
For any regular healthy intake should be minimum 2 liters of water. If you can go above, excellent.
Okay. So another question by the viewer is the premature hairing is genetical? Can we prevent it?
Yes, most of the premature graying is genetic, but it could also be a first time patient has developed graying of hair. Yes, it could be changed. Arresting it, we have very few hair treatments that actually help in reducing the graying of hair. What we do is we have these lotions and tablets that you need to take for a little longer, which would actually help in getting whatever is gray will grow out, but the newer hair will be, that's what the medication does, is try to keep that black. But if there's a family history, there is a genetic history, then sometimes you may not get that. Premature graying can lead to a lot of graying.
Okay. Yeah, okay. So another question by our viewer is, ma'am, can acupuncture in the head helps to hair growth?
I am really not sure about that, but it'll be a painful procedure. Yes.
Yeah, and it can also lead to hair loss, I think so. I don't know.
Hair loss, I don't know, but if it's not done by a trained person, then yes, you can get infections also with those needles and bleeding and everything. So I would say, I mean, really, I would have not tested, tried, or advised anybody to do that.
Okay, so we are running out of time, so I'll ask you the last question from the quick the last question. He's saying that I have been suffering from COVID infection, and after that I've been seeing the hair loss. What should I do?
Yes. So post-COVID, we've seen a lot of hair loss, but it has always been there. Any viral infection, any post-viral infection, you tend to lose a lot of hair. Why? Because your body undergoes that stress. So yes, there's a nutritional turmoil that happens that gives rise to a lot of hair fall. So we need to first check the multi-nutrients. So that is, we need to check your blood counts. If everything else is in range, then that means it's just because of that stress of the virus has given you hair. So we need to give some nutritional supplements, some hair lotions, and some hair tablets and fix it. If it does not get better within 6 weeks, then we need to go to the next step like a mesotherapy and PRP.
Okay. So the blood profiling is really important.
Yes, so blood tests are needed. Yes. We need to know what's happening.
Okay. So, doctor, would you like to give a take-home message or any suggestion to our viewers today?
Yes, so please take care of your health, eat healthy, eat well, and try and exercise as much as possible. Try stay calm. Easy for me to say it, but still every one of you must exercise. Practice some form of exercise, maybe a yoga or a run. That actually keeps your hormones regulating, your nutritional count being managed. Have enough protein in your diet, have enough nutritional supplements in your diet, eat enough fruits, vegetables. Follow a good healthy hair care. Do not do a lot of hairstyling unless you are at that profession or that need that you have to look good. Then please take care of your health if you're going to damage it with the heat or hair coloring. So if you're doing that, please help your hair to help you look good.
Thank you so much, doctor. Thank you so much, doctor, for sharing your expert advice on various issue causing hair problem. I'm sure viewers will be benefit from your advice and will be better prepared and equipped with managing hair problems. Thank you, doctor. It was a delight.
Thank you.
Thank you so much for your valuable time.
Thank you. Thank you.
Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today.